Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.
Coming up on Indiana Newsdesk, the latest COVID-19 developments in Indiana.
To those who think that we may be overreacting, I can assure you that we are not. Indiana is under a public health emergency. We are, make no mistake about it, at war with COVID-19, and we will win this war.
The virus has in large part shut down communities across the state, immediately causing the economy to start contracting.
We went from 100 miles an hour to zero fast.
Plus an explanation of the latest restrictions and what local officials are doing to avoid a healthcare crisis.
There are people thinking about what happens if we need to create more hospital beds, more places where people can be isolated.
Team coverage of the coronavirus pandemic right now on Indiana Newsdesk. Welcome to Indiana Newsdesk. I'm Joe Wren. Well, across Indiana and the country, life is a lot different than it was a week ago. Normally, busy streets are quiet. Signs saying closed for business hang on a lot of restaurant doors and windows. And even though it's only March, students are moving out of dorms. Tonight, we have more team coverage of the coronavirus pandemic. But first, I want to mention that our newsroom is doing our part to keep reporters and the subjects we interview safe. You might notice tonight that some of the interviews don't sound quite as pristine and that we have more people on the phone and talking on Skype. I hope you'll bear with us as we do what we can to deliver the news. This is uncharted territory for us too. We'll start with the latest numbers. The Indiana State Department of Health has tested a total of 554 people. There have been 79 positive test results and 2 deaths. The governor signed an executive order this week to help curb the spread of the coronavirus. Among the latest orders, for example, schools are closed through May 1st. Non-essential meetings are canceled. In-person events are restricted to 50 people. Hospitals and surgery centers must cancel elective procedures. The Indiana National Guard is activated to assist. Bars, nightclubs, and restaurants are closed to dine-in customers. A lot of the measures are aimed at enforcing social distancing that's shown to be the best way to mitigate the spread of the coronavirus. In Bloomington, in many ways, feels like the city has shut down. My colleague Ethan Burks has been talking to a lot of local restaurant and bar owners this week. He joins us now downtown.
The city of Bloomington boasts more than 100 bars and restaurants in its downtown area. Most days you can walk up to your favorite bar and grab a pint, or your favorite restaurant and get a meal. But for right now, most have closed its doors from fear of spreading the coronavirus. Nick's English Hut, a downtown Bloomington staple, closed its doors Monday. This comes after Indiana Governor Eric Holcomb ordered all restaurants and bars to close for in-person dining to help stop the spread of the coronavirus.
I was prepared for that closure. I wasn't prepared for what was going to happen next after I made those statements to my key people.
The governor's announcement still means restaurants can sell carry-out and delivery meals until the end of March, but that's not something Bright and her managers feel comfortable with.
We need a quarantine to lessen the curve. We don't need to be encouraging people to come out, let alone to work.
Bright says the staff will clean the restaurant over the next couple of days, and the remaining perishable foods will be given to staff members to take home. She says the next step is for the main managers to brainstorm a strategy for the future, but they will have to let some of the entry-level employees go.
It's heartbreaking. Yep, we're a family here, so when somebody's in trouble and can't find enough food to supply themselves, one of us will step in. They know they have a good network of people.
Other restaurants are facing the same problems. Local restaurant owner and entrepreneur Jeff Meese says there isn't much restaurants can do without slashing labor costs.
It's decimated. There's just no easy way. We had a meeting with 50 staff people yesterday who were helping very quickly get on state unemployment. That's going to pay them about 47% of their wages.
Meese is in charge of a large staff because he has ownership stake in several businesses such as Lenny's, Pizza X, Hive, Bloomington Brewing Company, and One World Catering and Events. Although Lenny's will also be closing during this time, Meese says Pizza X and Hive are equipped for delivery and takeout orders.
I'm worried that these smaller operations, when they just totally lose 100% of their sales, it's just not easy to ramp up a profitable delivery and carryout situation fast when your customers are not used to doing that.
Bloomington Bagel Company is a local restaurant willing to commit to the new rules put in place. Owner Sue Aquila says its entire downtown location has transformed into a walk-up window for takeout.
I actually, in early January, realized that we might have a problem coming down the pipe. So I was thinking about it a long time, and we knew that the garage doors would be a great solution for something like this to keep everyone protected.
Aquila says she's confident in her ability to pivot in this situation, but she questions why business owners are having to make these decisions themselves instead of getting more guidance. Luckily, the Bloomington Chamber of Commerce has a few resources on its website. The website shows what kind of emergency loans are available and what types of safety measures can be used to help prevent the spread of the coronavirus. But above all, the Chamber wants the community to still be active consumers.
Supporting local business, still making an effort to order from your favorite restaurant or find a way to shop online if you need something, will keep those people, your neighbors and your friends in business and help them continue to have jobs.
Predmore says it's still unclear what the best approach is at this point, but the most important thing is to keep communicating with local businesses as the situation continues to change. For Indiana Newsdesk, I'm Ethan Burks.
After Governor Eric Holcomb directed bars and restaurants to shop dine-in service earlier this week, many establishments were faced with the choice: adapt or close for the month. Most sit-down restaurants and bars aren't set up for delivery and pickup only service, but that's what they have to do if they want to stay in business during this pandemic. Our digital producer, Emma Atkinson, has been working on a database to make it easier for Bloomington residents to find and support their favorite spots.
Thanks, Joe. The database is really simple to use. If you go to our website, WTIUnews.org, you'll find a growing list of Bloomington bars, restaurants, and coffee shops, along with what they're doing to adjust to the governor's directives and how best to support them and their workers financially. Now, let's say you're craving Italian and French food. The database is searchable. So you just type in truffles, for example, and you'll see that it's open daily at 4:30 p.m. and offering both takeout and delivery services, along with specialty beer and wine pickup. Now, we want this list to be a community resource. So if you're a restaurant owner or a patron and see a place that's missing, email me and we'll add it right away. And Joe, we'll continue updating and sharing this list until our local eateries have returned to their normal schedules.
All right, thank you, Emma. The state's disaster declaration has opened up the opportunity for small businesses to apply for federal low-interest loans. The money can be used to make payroll, pay off debts, and other expenses during this health emergency. I sat down with Bloomington's Mayor John Hamilton this week for our usual monthly conversation, but nothing about it was quote-unquote usual. We kept a safe distance from each other. I didn't mic him like I normally do, and our conversation, well, it was dominated by the coronavirus pandemic. Mayor Hamilton says there's a lot of collaboration happening at the local level, and everyone is focused on diminishing the impact. So can you give us an update locally here? What's the reality on the ground right now?
This virus has killed thousands of people around the world. It's killing people in America. It's now killed, as of this time that I know of, 2 people in Indiana. We're working very closely, city government, county government, school system, Indiana University, IU Health, and other healthcare providers. We need to assume that it's here, because it probably is, and we're taking a lot of steps, all of us are, to diminish the impact.
Have you heard anything about testing and testing kits?
No, that's a really frustrating area. Look, this is not a time for finger pointing, but it's also not a time for bragging about what's going on. The testing has been a big failure in the United States. The World Health Organization says you should test everybody who you think might be infected, and we just can't do it. So we're way behind the curve on that, which means we have to play more aggressively offense to say, if you might have it, we kind of have to assume you do have it, and do the things that help protect us for that.
And there are a lot of people that are scared. They're worried because they feel like they are losing jobs, and heard something that a lot of restaurants that close may not even be able to reopen again. Is it too early to start thinking about those people or messaging to those people who are without jobs right now?
Absolutely not. The economic effects are real, and we're already seeing them. This is one area where I do think the federal government and the state government need to step up very quickly to make clear that if you lose a job, or if you can't work because of illness or family demands, we will take care of you. So I know unemployment insurance, for example, is critically important. That's why we have it when you lose your job. The idea of the federal government looking at supporting a stimulus package to help people, not just institutions, but help people who are dealing with this is really important. And I'm hopeful and I'm confident that that will happen. But you know, we could be in a recession right now. You often don't know you're in a recession until later. We're certainly going to see some economic costs of this. That causes stress with families and kids and hunger and housing. And we're doing a lot of things like not having utility cutoffs and trying to make sure there are no evictions and protect people so that we can get through the health crisis and then help rebuild the economy.
As the deadly coronavirus spreads throughout the United States, universities are making hard decisions that impact the lives of thousands of students. At Indiana University, students on campus and off are being affected in different ways.
Kayla Skinner is a senior English major living just off campus with 5 roommates. Up until last week, she had a job at a bookstore on campus. That's when Indiana University called off in-person classes for the rest of the semester and essentially closed campus. Now Skinner and her roommates are trying to figure out how they'll even afford to live in Bloomington, much less experience the kind of senior year they'd been imagining.
I really love being a student, and I feel very privileged to go to school here, so just not being able to say goodbye, it does hurt, and especially the bookshop.
Because the situation is so fluid, Skinner hasn't heard whether or not the bookstore will be able to reopen at all this year. She's also concerned about how she'll finish her English classes online. Not all of them will easily translate to online instruction.
So I have a poetry class that's pretty hands-on. We throw ideas out to each other and, write while we're in class. It's really hard to take collaborative classes and not be able to collaborate.
Students living on campus have to decide even faster what they're going to do next. Madeline McCarthy is a freshman at the Jacobs School of Music. When the university suspended in-person classes, she went home to Detroit.
We got that email around midnight. I was awake, so I read it, and then we got up at 4 in the morning, on the road by like 5-ish.
Like Skinner, she's also concerned about how the university plans to continue instruction for some of her classes, particularly music.
For music school, it's especially tough, for sure. I'm going to have to take my private lessons over my laptop.
This week, a group of organizations advocating for graduate student workers criticized the rollout of the university's plans to close housing. International students are particularly concerned about what to do next, especially if they're from countries affected by the virus or can't afford to get home. They say no one should risk losing housing in the middle of an unprecedented outbreak, and they want IU to commit to a policy ensuring vulnerable people can remain. The university says it hears those concerns and is working to accommodate students.
We've established a petition to stay form, which is now live on the Residential Programs and Services website. Through that form, students can give the reasons why they have to stay here in the housing that they have, and we'll try to work with them to see what is possible.
Kearney also says the university is aware of student concerns about how certain classes like music will be taught online or remotely.
But there are just a lot of balls in the air at the moment, and I just hope that our students and our faculty and staff recognize that we're just trying to figure out what's the best thing to do to make sure that everybody is as successful as they can be coming out of this really difficult situation.
But that will likely come too late for seniors who expected 2020 to be unique for reasons unrelated to the virus.
It's not IU's fault, and I know that. It's not our president's fault. I also know that it's an epidemic and it sucks. But I do feel cheated because we came in the class of 2020, the bicentennial class. So I thought we were going to have everything handed to us, you know, or we were going to have a nice commencement. We were going to be the most appreciated class of a long time. But now I don't even know if we're going to be able to walk, and that hurts.
For Indiana Newsdesk, I'm George Hale.
Coming up next on Indiana Newsdesk. With the U.S. having fewer hospital beds per capita than most other developed countries, how is IU preparing for the coronavirus pandemic? And you can't find hand sanitizer at the store, but how about at your local brewery? We'll have those stories and more coming up right here on Indiana Newsdesk.
The WTIU WFIU news team connects Indiana to the world. We bring you the top news of the day on radio, TV, and online. We round up the stories that have people talking each week and dig deep into the issues that affect your community the most. The WTIU WFIU news team is where you are and telling your story.
In a time of change, where can you find in-depth reporting and thoughtful analysis? Washington Week on PBS. Join moderator Robert Costa.
When I was at the Capitol this week, I encountered the same.
And a panel of award-winning journalists.
You're seeing a divided nation, and you're seeing.
For insights and perspective.
Tonight there was a key development in the
Senate. You won't find anywhere else.
What a week.
Washington Week.
Welcome back to Indiana Newsdesk. The U.S. has fewer hospital beds and doctors than most developed countries, so how are they making preparations and building capacity in response to the coronavirus pandemic? Brian Shockney, the regional president of IU Health, joins me now. Brian, first of all, thank you so much for joining me. I know how busy you are right now. IU Health confirmed last night it was treating a patient for COVID-19. Can you just tell us a little bit about the case and how the hospital went about that?
Yeah, so this patient came to us on about approximately the 15th of March, and we were already under what we call our incident command. So this is something that we stand up. We practice these drills twice a year for disasters, and so we had already all of our protocols in place. So the patient came, did not pass the screening questions, the 3 questions we asked, masked the patient, and from then on cared for the patient as though they were a coronavirus patient, a COVID-19 patient. That patient, then we sent the tests off to the Indiana State Department of Health, and after several days, they were able to give us a positive result. That's the State Department of Health then contacts the local health department of the county of residence. So this individual lived in their residence was Owen County. So they released the statement. Of course, media and everything went wild, social media at that point, and so we released our statement last night that we're caring for that patient.
And how's the patient doing? Okay.
Doing well.
Can you talk a little bit about how many beds, ICU units the hospital has? You know,
yeah. So we, again, we drill for this on a regular basis. And so we've been under incident command since March 9th from the IU Health statewide all the way through. So we do a continuous inventory every day and 3 times during the day. And then we now have a live dashboard that tells us how many beds there are across the state of Indiana, how many ventilators there are, all of those things. And so we've been increasing our negative pressure rooms throughout the hospital. We have our COVID-19 unit where we cohort all our patients that would be suspected or confirmed, where we will care for them, and then all of our ventilators as well. We've skinnied down all our operations to do nothing but care for these patients and care for what we know is to come, hopefully in a much lower level than what we've seen in other states, because we're doing the right things in our community.
And then testing kits, of course, have been the other big talking point. Are those becoming more available now at the hospital?
They are. So we were in phase one. Phase one of testing was your state Department of Health doing the testing, and now we're in phase two where we're seeing tests being developed by others. Indiana University Health now has testing available. We're testing our healthcare workers, and we're also testing high-risk patients. And then there are others around the state that are starting to do drive-through testing and those kind of things. That's phase three, where we're able to test the general public. And so phase two right now is making sure those that meet the criteria for testing actually get that testing priority.
And just really quick, is the testing just a swab of?
It's a swab in your nose.
In your nose,
yep,
okay.
Yep. And then we send that off, and yeah.
All right, well, thank you very much for being here. Appreciate all of the work you're doing.
Thank you.
Well, local health departments are taking different approaches to prepare their COVID-19 responses. Those plans can vary widely depending on resources and whether a county has a critical access hospital. Now, in rural Indiana, Owen County was taking a wait-and-see approach, but this week the county got its first confirmed case of COVID-19. As Brock Turner reports, the quickly evolving virus is forcing counties to continuously update their strategies.
Dr. Barbara Diane Wells is an internal medicine physician and the Owen County health officer. When we spoke last week, she said life was continuing pretty much as usual in Owen County. But something everyone is learning with the new coronavirus is things change quickly, day by day and even hour by hour. Owen County confirmed its first positive case of COVID-19 on Thursday. Health officials aren't releasing much information, but we know the person is hospitalized. Wells says the community is maintaining space. Most churches have moved their services online. Activities have been canceled, and most folks are staying home. She says that makes the lack of testing less critical.
I don't have a specific treatment except for your symptoms. So the fact that I can't test you or everybody else who just happen to want to be tested doesn't change my behavior whatsoever.
Despite well-documented shortages across the state and the country, Wells believes the attention to the lack of testing capability is misguided.
Having been in medicine for 40, 50 years, it's also unreasonable to think that a new virus can come on the scene and that we would have the ability to test for it within a matter of weeks or months. That's not the nature of the science, and it never has been.
Other countries, however, have accomplished that. In the United States, private companies have entered the space and capacity is slowly expanding, but some worry that it could be too late. Local health departments can impose additional requirements to augment those coming from the state. For example, the health department in Fountain and Warren County opted to have residents self-quarantine after visiting high-risk states and traveling outside of the U.S.
I think that it's critically important for public health to take a lead here. We have the authority to issue this guidance to our communities, and I think we also have the duty to do that.
Health officials there say it's a move that will help protect the most vulnerable populations. But the Fountain and Warren County Health Department is unusual in what it's doing. Marion County has done similar things, but most local health departments, including Owen County's, are relying on guidance from the state. Even though local health departments do not yet have the capability to test for the virus, those expressing symptoms should still contact them or their primary care physician to see if they're eligible for a test. Wells says if people are concerned about the virus, simply washing their hands and cleaning all surfaces properly will help keep them protected and do a lot to keep them healthy.
Up our 20 seconds, nice and foamy there. Then we rinse our hands carefully. Get towels. Dry our hands well. Turn off the water.
For Indiana Newsdesk, I'm Brock Turner.
As the coronavirus continues to impact nearly every aspect of American life, local businesses are stepping up to try and mitigate the virus's impact. Reporter Mitch Legan takes us to one Bloomington business that's trying to keep Hoosiers' hands clean.
With demand for cleaning supplies currently outpacing supply in Bloomington and across the U.S., a local distillery is taking matters into its own hands. Cardinal Spirits on the city's southwest side is making hand sanitizer for people free of charge.
A friend of mine sent me an article about a distillery in Portland that was mixing up their own hand sanitizer. So I quickly looked up the recipe online, found a few recommended recipes from both the FDA and the World Health Organization, and mixed up a batch Saturday.
Cardinal Spirits has made 3 5-gallon batches of hand sanitizer. Cork says each batch essentially contains 2 ingredients, alcohol and an emollient, or skin softener. He used vodka and baby oil for the first batch and is now using glycerin.
We have a dispenser here set up to refill your own bottles. We do have some small bottles, but we don't have many, so we ask that if you have your own, please bring those.
Cork says he's gotten requests from a number of healthcare workers. A woman stopped by Monday to get a bucket of sanitizer for the Bloomington Police Department. Cork says not to expect the distillery to become Cardinal Spirits and sanitizer anytime soon. He says they'll only continue making it until regular production and distribution can get back on track.
Anything we can do to help, we're going to do. And anything the public can do to support locally owned businesses, they should try to do as well.
Cardinal Spirits is open from noon to 8 p.m. For Indiana Newsdesk, I'm Mitch Legan.
Mr. Rogers has been a calming force in the lives of so many people. He often tackled difficult situations with compassion and positive attitude. And this week, the Buskirk-Chumley Theater displayed one of his more iconic quotes on its marquee. It reads, "When I was a boy and I would see scary things in the news, my mother would say to me, 'Look for the helpers. You will always find people who are helping.'" So our thanks this week to healthcare workers who are working to care for the sick, to grocery store employees who are stocking shelves and waiting on customers, and also a big thank you to my colleagues. More online at WTIUnews.org. Have a great weekend.
Indiana Newsdesk is made possible in part by Smithville Fiber Internet, streaming TV, home security and automation in Southern Indiana. More information at smithville.com. MALLOR GRODNER Attorneys, providing legal services to clients and the community. Understanding, expertise, results. Bloomington and Indianapolis. LawMG.com. IU Alumni Association, connecting IU's network of alumni and sharing the Indiana spirit through scholarships, advocacy, and volunteerism. Alumni.iu.edu. IU Center for Rural Engagement, extending IU Bloomington resources to improve Hoosier lives in partnership with communities and organizations. Rural.indiana.edu. And by WTIU members. Thank you.